I am Liz Powell. I am the founder and head of G2G Consulting. I started G2G after working on Capitol Hill. And when I was on the Hill, I was a legislative director for two different members. One member, I staffed their small business committee work, and the other member, I staffed their national defense, or the Armed Services Committee that did the National Defense Authorization Act every year. So I learned a lot about the different funding streams within DoD. I also did a lot of health policy. So at G2G, we have merged a lot of my background into the services that we provide clients. And so we started G2G in 2007. And since then, we've raised over $500 million, $545 million non-dilutive government funding. Much of that is for the life sciences and in that defense space, that defense health innovation space. But we've also worked with other high-tech innovators and nonprofits. So we've worked with a range of folks, but all are change makers, definitely trying to make a difference in the world with innovation, with better programming and services addressing unmet needs. So that's a little bit about me and G2G. We can go to the next slide. We are going to cover these topics today with today's webinar. We want to address all the different funding sources that are out there, how we do our grant tracking, and then navigating DoD funding streams and building relationships within DoD to access funding. Talk about congressional ways to add funding, and then MHSRS, which I know is the main interest for folks. So that is the Military Health Services Research Symposium that is every year in August. We've got special guest Pat Gallagher, who has many hats that he wears. He's got many years of experience in the life sciences as an investor, as a CEO, as an entrepreneur. He's done tons of collaborations and has a great success story in working with DoD. So we thought it'd be really interesting for you to hear from him. And then we'll close out with final tips and takeaways. Next slide, please. So I shared my background. So the background of G2G, we've done a ton in the life sciences. We are located in several places throughout the Midwest and on the East Coast. And we have different collaborations for many years in Pittsburgh and Boston, California, other parts of the country. And then our record is not just in that non-dilutive space, in securing funds through legislation as well as through agencies, but then also working on CMS reimbursement, even FDA approval, addressing warning letters and other challenges with the FDA, crafting legislation, and just leading these advocacy campaigns to change policy and regulations. That's something that we've been very active in. And then we've also organized many collaborations and coalitions working with a lot of the different state bio chapters. And in fact, if you are a member of some of the bio chapters that work with us, you get free access to our government bioscience grants report, which Aditya is going to cover in a minute. We also work with Grip Venture Studio, which is all about helping companies launch and grow through every single aspect that you can think of in needing to do that. Grip Venture Studio addresses. We've got experts all over the map when it comes to VC investment, government funding, marketing, pricing, timing, all those things. So it's a great resource. And then the Defense Medical Research Consortium, we're active members of that, which is very focused on the congressionally directed military research program, which is a phenomenal source of funding we're going to talk about in a minute for the life sciences. Springboard's all about launching and growing women-led businesses and has a really great cohort in the health innovation space and in women's health. NABO, which is women-led businesses, and then Women's Health Advocates, which is focused on the holistic, head-to-toe, over the lifespan women's health gaps and ways to increase innovation to close those gaps. So that's a little bit about G2G and about me. Next slide. So now I want to talk about the different government funding sources. And it's important to understand that there's a few ways to access funding and to sort of shape this process. So I'm going to start with the bottom right, which says funding categories. So there's grants, there's discretionary contracts or funding, there's procurement, and then there's appropriations legislation. So that's really the four ways to get it. So with grants, tracking grants, responding to those opportunities, and then even shaping them behind the scenes, which is a lot of what we do by just educating program managers and working with them together. Discretionary funding. So at the end of every year, it's sort of spend it or lose it. That happens August and September because the new fiscal year starts October 1. So having a white paper in the system, having those relationships already makes a huge difference in accessing the discretionary funding. Procurement is just straight up contracts. And what's interesting is that sometimes a research effort is actually a contract, not a grant. So, for example, BARDA, which is focused on Biomedical Advanced Research Development Authority, they are working in mass casualty response. So they do contracts. Within DARPA, they will do both contracts and grants. So it just depends. But it's important. And then even within SBIR, there's this sort of one time a year contracting opportunity. There's phase three. So there's different, they call it colors of money or sort of vehicles for funding that it's important to understand the differences and things that you can and can't do in a grant versus a contract. And then lastly, the appropriations legislation, which I'm going to talk about a little bit more in a second here. But there's ways to put in language and funding streams into the appropriations bills that turns into funding for your efforts. Okay, so now we're going to go back up to the top of this. So if you look at this pie chart, you see the big blue section, that is defense. So obviously the biggest takeaway here is that the most funding goes to DoD. If you look at all these different agencies that also could be great sources of funding for your life sciences, for high tech innovators, it is a much smaller pot of money or piece of pie. And then if you go over back to the right, the Department of Defense funding in 2024, which was basically the same in 2025 because they did a continuing resolution, you can see that there's a ton of money for medical research. There's $3.28 billion for medical research. And then S&T is science and technology. And then this Defense Innovation Unit is yet another source. So there's lots of R&D funding within DoD. Now in 2025, we did a continuing resolution and the CDMRP program I mentioned earlier, which stands for Congressionally Directed Military Research Program, received a 57% cut. Which was devastating. So that meant a lot of those grant programs could not get funded. However, in FY26, there's an effort to increase funding. So the House recently worked through committee the Defense Appropriations Bill for FY26, and it has 13% increase for DoD overall. And then it includes an increase to 1.3 billion for the Defense Innovation Unit. For the CDMRP program, it is $700 million, which is 50 million above last year. So it's a little bit of a bump. We expect more of a bump in the Senate. And then there's also another piece of legislation pending called the Medical Research for Our Troops Act, which would restore all that funding for CDMRP. Why am I talking about this so much? Because this is a major source of funding for you folks. Like, I really want you to go Google CDMRP or Congressionally Directed Military Research Program and learn about this program. It is a phenomenal resource for military medical innovation. So that's why I want to make sure you understand that. The biggest takeaway here is just that there's a ton of money in DoD. So if you can fall within Department of Defense or military medical, that is a great resource. And we have found a lot of people just don't know how to navigate that. So we really want to provide that expertise for folks. And then also simultaneously, amidst all the budget challenges that have been going on, there's also been this consolidation effort within DHA, the Defense Health Agency, that is also impacting funding. So it can be very confusing. Today, we're just sort of touching very top of the iceberg, but we're happy to be a resource if you have more questions on that later. And with that, we'll go to the next slide and I will pass it to my colleague Aditya, who I ask you to share your background before you dive into the slide because it's super fascinating and really helpful. So with that, I pass to you.
Thanks so much, Liz. So hi, everyone. Good morning or good afternoon, depending on where you are. My name is Aditya Girish. I'm the Government Affairs Manager and Biosciences Director here with G2G's DC team. I've been with the firm full-time for about 3 years. My background's a little bit different than Liz's and other members of our group, in that I'm a trained scientist myself who transitioned to government relations. So I was doing my PhD in biomedical engineering, coincidentally in a military relevant area of hemorrhage control, so developing therapies to stop bleeding. And so I was able to initially work part-time at G2G, actually doing some of the work that I oversee now in terms of tracking grant opportunities and funding opportunities for our clients while I was still finishing up my degree. And so after that time, worked a little bit at a medical communications firm, but then came back to G2G full-time where I uh, uh, work primarily with clients that are in our health and biosciences space. A lot of that is, in the defense health space, as Liz has just described pretty well. And I've been to MHSRS a couple times over the last few years, and it's been a really great opportunity. And I'm eager to talk about that in a couple of slides. But anyway, wanted to just touch upon the content of this slide. So Liz mentioned that, G2G has a grant tracking service, which is the GBG, or Government Bioscience Grants Reporting Service. So at a high level, it comprises of a report that is published every month around the 10th of each month. And it's a comprehensive and updated list of all live funding opportunities, pre-announcements, notices of special interest, and other engagement opportunities, including requests for information prior to a grant being published that are released by federal government agencies, departments, entities, as well as consortiums that are relevant to the life sciences, medical research, medical technology, defense health. And so this is a curated report designed for ease of use by entrepreneurs with key information that's presented in a very streamlined fashion, including the opportunity title, a brief description, issuing agency, funding levels, deadlines, and key links. So very easy way for folks who are busy and looking for stuff that's relevant to them to just quickly scan rather than, trying to sign up for grants.gov and other resources yourself, trying to parse through all of that. So we make it easy for you. And so this report also includes R&D opportunities that are put up by the Defense Department and its affiliated entities, including DARPA, the Defense Health Agency, and the Military Health System, and their various consortia. And so these tend to range from broad agency announcements that are, in the report every month until they expire because they're usually, open for years, to short-term multi-topic calls, targeted program announcements, contracts, DoD, SBIR opportunities. There's quite a lot that's in there every month. And so related to the report, accompanying the report every month, we do a free webinar the third Thursday of the month at 12 p.m. Eastern time. So roughly 1 week after the report is published, where for 30 minutes, we discuss key highlights of the report, usually going through about 6 to 7 opportunities of note. And then for the second half of that hour, from 12:30 to 1 Eastern, we hold a customers only consultation session that's open to G2G clients, companies that have signed up for the reporting service as on a month-to-month or a yearly basis, as well as affiliates for certain bio chapters who receive it as a member benefit. And so during that time, we provide more in-depth analysis on trends that we're seeing in the funding landscape, new initiatives coming down the pipeline, decisions made here in DC that are impacting access to funding, and the bottom line for companies in the life sciences and medtech space, as well as specific questions, that folks might have pertaining to their work. And so this service, both the report and access to the entire reporting service webinar, again, provided to companies that work with us. You could choose it to purchase it as a standalone product for either 100 a month or 1,000 a year. And again, it's also available as a membership benefit to companies that are affiliated with a select number of bio chapters and other organizations. Could we go to the next slide, please? Yeah, so there's about a dozen or so bio chapters and other organizations that provide the GBG reporting service as a member benefit. So if you are a member of any of these organizations, these chapters, if you're not already aware of this report, again, access to that private consultation every month is a member benefit. So we encourage you to take advantage of it. Just, last week on our June webinar, we had about 15 folks from various bio chapters dial in. And I anticipate we do anticipate this group to grow in the near future. So if you are a member of these chapters and aren't aware of how to access the service, please reach out to your point of contact, or feel free to reach out to us as well. And if your affiliate chapter is not on this list, again, feel free to contact us or your point of contact, and we're happy to work with you on that. So next, let's transition to discussion of MHSRS, the conference. That's the main attraction of this webinar. Could we please go to the next slide? Oh, sorry. I jumped a little bit. I'll transition it back over to Liz to talk about defense and Congress.
Yep. So we just wanted to give you an overview of DoD and all the opportunities that are out there for the life sciences. So 9.5 million beneficiaries, 736 military treatment facilities or MTFs, 136 of them are located overseas. And then here, there's 45 military hospitals and medical centers. There's some 500 military medical clinics. So clearly, there's huge opportunity within DoD. I mean, if you think about it, all those bases, and they're serving not just those who are in the military, but their families. So it is a tremendous population. So all the issues that we face in civilian population, they are facing in the military. Then on top of that, you've got additional focus on trauma care, injuries that happen both in training and while in theater or on the battlefield. So there's just tremendous opportunity. And then within Veterans Affairs, which is separate from the military, but obviously very connected, there's 23 VISNs, which are these regional sections of the country that manage medical centers. There's 172 different medical centers, 800 community-based outpatient clinics, 126 nursing home units. I mean, there's just so much in the medical space that these are folks that need medical innovations. And so, if you can make yourself sort of fit in with that need, then there's tremendous opportunity for you for initially in that research phase and then pulling over to a procurement phase. So, that's why we wanted to start out with sort of tip of the iceberg explanation of how DoD is set up and these sort of medical innovation opportunities for you. And with that, I'll go to the next slide, which is focused on Congress. So again, this is just tip of the iceberg to give you background. Um, so every fiscal year starts on October 1st. And so, as I mentioned earlier, you sort of have that end of the year, spend it or lose it activity that happens, starting to happen sort of end of July into August and September. So getting to know these folks and participating in MHSRS is a great way to develop these relationships and get known within the system, and then do a white paper submission. Once you're in their system, several program managers have told me that at the end of that fiscal year, they're kind of looking through, ooh, we have some funds here, and it could be for various reasons. A grant fell through, or couldn't be completed, or there's a lot, and obviously with things, the budget getting done so late and the CR, that can also impact things. But for whatever reason, there can be these funds that are available. And they also have this broad agency announcement or BAA that is another vehicle where if they have funds, they can direct through that. So just having a white paper in their system gives you a leg up in accessing funds. And then you do have to obviously fill out paperwork and do a submission, but at least you're in the system with that white paper. So that's why we really emphasize that time of year. But backing up, they're supposed to finish the appropriations process that funds DoD and all the different agencies by October 1. That never happens. They always do continuing resolutions, and then they start up. They're supposed to finish by December and then start off fresh in January. This year, that did not happen. It got pushed back, which is normal with a new president, no matter who that president is. So that is kind of normal that things can get pulled over into the next year. But for the most part, the beginning of the year, you're getting that budget proposal from the president, and then Congress is responding. And they do so through these 12 appropriation bills where they set funding levels in response to what the president set out. This year, it's a bit funky because he only put out a skinny budget and he did it very late in May, which, again, any new president, it's going to be late. But it's very late now. We don't even have a full budget. And so now Congress doesn't want to wait any longer, and they've started marking up their bills. So, and markup is just language for writing their bills, amending them, and moving them through subcommittee to full committee to then the floor. The House is always ahead of the Senate. It's actually in our Constitution that all funding measures must start in the House. So the House has been marking up their bills. The Senate is still doing hearings, and they will do their bills later, hopefully before the August recess. But they might just have drafts before and then actually do the work in September. But within those 12 bills, you can see the red box around defense. So that's the one bill we're talking about today. But as you look around and see these different categories, you see Ag FDA. So FDA is in there. That could be of interest for a lot of folks. MilCon VA, which is on the right side, that stands for Military Construction and Veterans Affairs. That also could be of interest for some folks. And then at the bottom, sort of near the very bottom of the circle, a little bit to the left, labor dash HHS. That is the Labor, Health and Human Services and Education Appropriations Bill. So that's definitely got a lot of areas of interest for folks on this call. But we're really focused on defense today because remember, huge funding source, got 13% increase in the defense budget proposal from the president for FY26, while all non-defense got a 23% cut in the budget proposal. So that's why we're really focused on defense. Um, Within that bill, unlike these other bills, you can actually put in directive language around funding certain life science innovations that would meet military need. You can do directive language, sort of setting new standards and policy, and then you can also do actual funding lines that are called plus ups. Um, Again, not to get into the weeds, we're just sort of doing tip of the iceberg. You can talk to us further if that's of interest to you. We are working on several initiatives there, and we have some great case studies actually in shaping that process and putting directive language in and putting funding directives in. Then that final bullet you'll see is NDAA, which is National Defense Authorization Act. And that really sets policy. So you can put funding directives in there as well as policy directives. But because it's not a funding bill, it's really just setting out what DoD needs to do with much more detail than the appropriations bill that is really just the funding levels. So a really thorough approach, which is one we use, we are going after both simultaneously, House and Senate, so all four at once. But knowing those nuances of what you can ask for and what you can really shape within each bill, I think is helpful. Um, and the point of this slide is just to point out that there are funding streams through Congress in addition to the agencies. So we just want you to be aware of that. And working with your congressional delegations is important for them to know what you do, your impact in the district. And if you're in multiple districts, because you're in multiple states or what have you, working all those angles is really important. Members of Congress, they have access to people, opportunities that you might not be aware of. So it's really important, I think, to have a balanced approach when you're trying to engage with government that is agency side as well as congressional side. So with that, we're on to the next slide, and I am passing it back to you, Aditya.
Thanks so much, Liz. Yeah, so let's get into MHSRS. So MHSRS, again, the Military Health System Research Symposium. It is an annual military medical conference. It's the largest of its kind every single year. It lasts 4 days, and we held a little bit earlier than it usually is in early August, from August 4 to 7 in Kissimmee, Florida, at the Gaylord Palms Resort. And so the conference dates and venue were literally just approved a few weeks back. And registration, we found out shortly after, will open on July 8th at noon. So just putting that, noon Eastern time, just putting that on your radar. So some background, who attends this conference? So it's really well attended from various quarters, including industry, academia, clinicians, and researchers affiliated with DoD, department healthcare leadership, program managers, as well as folks from the VA, as was alluded to. Last year, it was, I believe there's about 4,400 folks attending. So it's definitely a bigger type conference along the lines of, your, not quite, but along the lines of your JP Morgan bio. It's that kind of level. And so at the core, this is, a scientific conference, I will state. So you have your podium presentations, um, you have poster sessions, opportunities to network, opportunities to visit the exhibit hall. So all of that's there. And it's also a forum for vendors to highlight their products and services. G2G has been attending this conference for many years now. And we've really sort of developed a niche in working this conference to help folks build connections and meet key decision makers at DoD. And that's really the benefit of attending this conference. Even if your work, your product, your idea don't precisely align with any of the breakout sessions or the topics that are listed, you get really, really key insights from high-level DoD leaders on where the department is going, what are the priorities, upcoming emerging priorities of the military health system. And that's really knowledge that can allow you to help frame or reframe your work so that it's better aligned with military priorities and help you better align with downstream funding opportunities. Of course, it's an unparalleled opportunity to network. Even if someone you meet at the meeting cannot directly help you, chances are he or she knows half a dozen people in their network who are not public facing, who might be better fits for you. And there's a ton of post-conference outreach that we have conducted for companies that we've helped over the years that have really borne fruit in terms of collaborations, funding opportunities. And of course, we'll get that into that a little bit in a little bit. Um, and so the conference itself can be, definitely overwhelming, but the downstream rewards of strategic planned engagement can be manifold. It does take time, but there are multiple touch points you need to have in engaging with DoD. But this is definitely a very, very good start, even though it's a big conference, because it's one of the few forums where leaders and other program managers, people in the middle who are key decision makers, actually all convene in the same place. So definitely something we recommend to folks who are interested at all, even if tangentially, in engaging with the military. So just for some context, the conference is divided into four really broad topic areas: warfighter medical readiness, expeditionary medicine, warfighter performance, and return to duty. And that encompasses, the specific subtopic areas and breakout sessions, including some of them that I've listed here that are underlined. Excuse me, go back one slide. Um, Such as infectious disease, medical AI, injury prevention, surgical care, pain management, hemorrhage control, as well as women's health, which is definitely emerging as a major topic area, given that women are the fastest growing subpopulation in the military. So yeah, now we can go to the next slide, please. Right. So just a little bit more detail on some of these breakout sessions. So these are just a few examples of sessions that are linked to specific types of injuries and diseases. That's one theme that you sort of see, things like radiation injury, burn care, antiviral countermeasures. The DoD military health system does a ton of stuff in this space, given, the risks that warfighters face from emerging infectious diseases. Understandably, very interested in antibiotics, repurposing, using existing antibiotics to better treat, difficult combat wound infections. Blood and transfusion medicine is obviously, bleeding out and uncontrolled hemorrhage is the number one cause of death in the military health system and in the field and in war zones. So obviously there is significant interest, and I can attest to that given my past background. And also things of, obviously prosthetic exoskeleton solutions are of interest in making sure folks who are severely injured have the opportunity to return to duty. And so we can also go to the next slide just to see. So previously that was, injuries, specific types of diseases, but there's also a lot of sessions, a lot of folks there who are affiliated more with care delivery and wider, system issues, obviously robotics, is a key area for, divisions of DoD like DITRA or TATRIC. So there's a lot of folks from there. The overwhelming conversations about AI and military and machine learning. The military is also very heavily engaged there in trying to utilize those spaces for precision medicine and operational readiness. As I alluded to earlier, there's a significant focus on women in the military and ensuring that their unique health needs are being met while they're serving. Broader management of complicated situations like TBI, organ failure, as well as behavioral health, which there's too many sessions to count on in that space. Just giving you a flavor. And then, yeah, I think that's it in terms of our MHSRS overview, and we can transition to the next slide. So we'll now transition to a conversation with our special guest, Pat Gallagher, who is a very storied entrepreneur, VC, and life sciences leader. Among his various positions is as the CEO of Voltron Therapeutics, whom G2G has had the privilege of working with for several years now. For some context, Pat's company was selected to present at MHSRS in 2022 and 23. And as I said, he has many different positions that he can certainly go into a little bit more about. But he's found engagement with DoD, including at MHSRS, to be particularly fruitful. And wanted to offer the opportunity for him to share some of his insights. So with that, I think Pat, if you want to come on camera and then we can take the slide down and we can go from there.
All right, let's see. And thank you for those kind words, Aditya. Geez, I feel pretty puffed up here. So thank you. Okay.
Um,
It's
yeah,
not letting me there we go. There we go. Terrific.
great. Give me 1 second. So all right, let's start at the very beginning. Why don't we talk about why don't we just set the scene for folks? Can you tell us a little bit more about your background, Voltron, your company's work, and then we can go from there.
Yeah, sure. So my background is I spent the first two-thirds of my career on Wall Street. So I'm a finance person. I'm not an MD or a PhD. So I don't have a scientific background in that sense. I spent a lot of time and talked to thousands and thousands of companies in the healthcare space over that time, investors, big hedge funds, sovereign wealth funds, mutual funds, publicly traded companies and private companies, really assessing their capabilities, backgrounds, teams, that sort of thing. So that was the first two-thirds of my career. The last third, I started getting involved with boards, a couple of public companies as well as private companies, and that led me to really rethink where I wanted to be as life went on, and started to work with some of my former colleagues in the healthcare space to identify assets, license them out of places like Duke or Mass General and Harvard, and put teams around them. One of those was Voltron, which came out of Mass General and Harvard. It's designed to really address a number of needs that the team at Mass General and Harvard, who are immunologists and virologists, thought were lacking in their field. We liked it a lot because it had broad applications potentially in engaging the immune system. So that's how we got to Voltron, and that's what interested us in it initially.
Great. So can you go a little bit more into, how with your role at Voltron, you wanted to pursue, partnerships, working with government, um, when you were ready to do that, and what were your overarching goals there? I think that would be helpful for people.
Yeah, so a couple things. Based on the technology, it's a platform that elicits a broad immune response, B cells and T cells. Those are the the two main components of the immune system. The government had needs, obviously during COVID with emerging infectious diseases, but also existing diseases, and we felt that we could make a difference there because of the broad engagement of the immune system and the fact that we could do this in a rapid fashion. So 90% of our vaccine or therapy, depending on whether it's an infectious disease or cancer, is the same every time. So you could swap out the other 10% depending on what you were trying to target. So it seemed like it would help the government in many different ways achieve some of their goals, and got introduced to Liz from a friend who had used G2G in raising money to advance their technology. The That money was really instrumental, and there were a couple of different tranches that allowed his company to go from back of a napkin, literally, a one person office in Richmond, Virginia, to through development and through approval and into commercialization. And that grant money was instrumental in the middle in allowing that to occur. And the end of the story includes a nearly $300 million sale to a Fortune 500 company. And he would tell you that this was really enabling, and his work with G2G, when other investors were, getting impatient, the grant money really helped push his platform forward. So I had some familiarity with his process, and of course, working with Harvard and Mass General, who, those folks write grants for a living, basically, understood that there was opportunity um, in pursuing government money. Obviously, my background was really, I'm used to securing money from private investors and individuals, as well as bigger funds, but they have specific wants and needs, and they might not care about me pursuing Lassa fever because it's not a big commercial market in the United States. They'd rather have me pursue cervical cancer, which makes sense. But that doesn't mean the technology shouldn't be applied to solving problems in other areas. And so the government money, in our view, if we could find some, would really enable us to pursue some side projects that were important for humanity, but not necessarily important for those specific investors, if that makes sense.
Oh yeah, definitely makes sense. And so I think that allows us to segue a little bit more into, what the DoD angle was. And you sort of touched upon it, before on the COVID side, but, are there some other, broader concepts, where you found alignment with, Voltron's technology through our discussions?
Yeah, so let me start by saying when we started this journey with Liz and Aditya and the team, it was during COVID, and there was zero money available for anything that was non-mRNA. So we were going into an environment where it was nice to talk about a vaccine that might help down the road, but there was no money that day or that quarter or those 6 months for something outside of mRNA. But of course, the DoD, I would say, has had a critical role over time in advancing translation of technologies into the clinic, into people, into uses for their specific needs, but also hopefully the general population. And that could be anything from diagnostics to therapies to prophylactic vaccines in the healthcare space. There's, of course, many other opportunities here. The opportunities that we saw, and I think you touched on them a little bit, Aditya, were a warfighter readiness, and that could be any, that's basically operational safety and efficiency. So better night vision goggles, vaccines before you get sent someplace where, there's a new virus that we're not exposed to in the States or Germany or wherever, to, anything that can make the warfighter better at their job and keep them safer and their team operating better. So we checked that box because we could hopefully come up with a vaccine pretty quickly based on its flexibility before deployment. Operational medicine is field medicine, of course, and that box we also checked if somebody new were coming into that team, you could get them vaccinated really quickly in the field, and or if new groups got deployed. Again, this spans many, many technologies. That's just where we fit in. And then, of course, the dual use aspect of it, we made it pretty clear to the DoD, and they really like this, and I would encourage everybody to think about it, your use in the general population as well. So this was something we were working on for the DoD that would translate into other opportunities. And as it turns out, we're pursuing additional opportunities now with Liz and the gang and cancer, not just infectious disease, because of this particular product's mechanism of action. So that dual use, I think, was really attractive to them. And we had a team in place where they could legitimately look and say, yeah, these folks know how to get that into other applications, which if you have a team like that, I would really encourage you to pound your chest a little bit on that.
Yeah, that's great. That's great. Want to go into a little bit more specifics, now that we've set the scene, how you were actually able to engage with DoD, including, your participation at MHSRS, both you and the team from Vic.
Well, I think Liz and you have highlighted the complexity of the entire organization, and it really is complex. And so, G2G's mentorship and guidance through that process was frankly invaluable. So they helped us. G2G helped us create our strategy and identified the important points of contact to start our discussion. Different agency leaders and researchers and people associated with specific disease states. Some of our original work had been done in Lassa fever. So we, of course, went to those people first. Now, interestingly, as an example, they didn't have any money, even though we had, a lot of experience in Lassa fever and had published papers in it. So they sent us to the pox people, right? So this could very well be your experience. You start where you think you add a lot of value, but based on your team and what you have, you get sent somewhere else. So I'd be prepared for that, and I think that's really a key component of just this process. Getting the communications right, of course, is critical. And so in our case, we had a delivery platform, as I said, that could engage and enhance the immune system, and could do it in different ways. And so working with G2G, we came up with the concept of it was a missile and a warhead, and 90% of it was the same every time. It was the delivery mechanism. and we could swap out the warhead for infectious disease or cervical cancer or prostate cancer, whatever you were targeting, you could attach something new to it. And of course, that resonated pretty well with scientific people, but with non-scientific people as well, which was key. There's some folks, program managers, who might not have a PhD in biology. Uh, just the visual, anecdotal version of your story is pretty useful. So it was strongly recommended to us to attend MHRS, and we engaged with a lot of different folks there that G2G arranged meetings for. Some of them were on the fly, by the way. I'd get a text from a DTR, Liz, like, "Hey, I'm about to have breakfast with so and so from the Navy, or this general from the Air Force," and they're super interested. And so while there was a schedule that we maintained. There was a lot of interaction that was on the fly, which was frankly terrific. And we talked to folks from Walter Reed and DARPA, a lot of different agencies. And so it was great. Those meetings ended up being a springboard for further discussions. It's, you're going to have to follow up. And again, I think that our experience was the G2G team was super helpful in that regard and keeping us on point. And then finally, we had a lot of calls with Congress and Senate. I think we had over 70 in a couple of months. And there were key members who had influence in particular areas like health and human services, defense, and people in our local states. The team was spread out. And I think that advocacy that we developed there was very, very helpful at the end of the day in the whole appropriations process. So that's something I could never, ever have done on my own. I wouldn't have known where to start. Actually, at MHSRS either. So they're complicated. They're complicated environments to navigate, and so the help really does drive success.
Yeah, you really touched on, how it was a really multi-pronged
Yeah.
effort that we had. And I think two of them definitely converged at the conference. We engaged with a program manager at the Defense Health Agency that, we met with. And so we became aware of, this specific, congressionally directed line in the budget for vaccine development. And I think part of that will also come into play. We were talking about your platform with so many different, offices on the Hill who are concerned, in the aftermath of the pandemic about, making sure we were prepared for the next one, right? And making sure our warfighters had, prophylactics ready for them in case they faced, emerging infectious diseases of unknown origin. And so I think those two aspects converge. We became aware of this line through our conversation with that program manager that we had, a key meeting with at one of those lunches. And it was a lot of it was on the fly, like you alluded to. So, and I think, from that, there was an opportunity that arose, Voltron was able to apply to. Do you want to talk a little bit more about that and how it sort of culminated in this great opportunity for you all?
Yeah, well, I think you've hit on a number of the key points. First of all, I didn't know that the conference existed. I'd been in the business for 30 years and had no clue that this existed. So it really is a target-rich environment for conversations and advocacy for your particular platform. And as Aditya mentioned, we had a lot of conversations, and we were able to connect with the person who was kind of spearheading that line item in the budget face to face at the meeting. And of course, we all know that that's gold, right? I mean, it's different than a Zoom call. It's different than emails back and forth. And not only did she help at the end as we were trying to figure out logistics and operations, but really kept us apprised of like how to proceed along the way if we had questions. So having that point contact and being able to bounce questions off of them about the application process, the whole thing was invaluable. So, and again, that FaceTime that you guys were able to get for us was, I mean, I think that was the pivotal point for the whole effort.
Yeah, and it, actually got you a vital amount of, resources at the end, right? It was a key grant for Voltron and the Vic, I forget how much it was actually.
It
It was
was $6 million roughly,
Yeah.
and it's driving three different initiatives that we were able to work with the DoD to come up with that benefit the DoD, but also benefit the company and the platform and the manufacturing effort, et cetera. So it really was a win-win for both. I would also say that just as an aside, I was super impressed with the rigor of the DoD. You know, really smart people asking really good questions. So it is a rigorous process, but because the process is rigorous, the optics, not just the non-dilutive capital, but the optics to the outside world that you were able to secure the money is really invaluable because the people on the other end of the phone were super sophisticated.
Great. And so to wrap this part of the conversation up, do we want to, what's your advice for companies that are, interested in, engaging with DoD? How do you get started? Um, yeah, why don't we just end on that, and then and wrap it up there.
Yeah, so thank you. So again, m- the complexity of the DoD is a real thing. Identifying the people to talk to there, the right people, is a challenge for those of us in the wild, right? You need some folks with some experience, and the that experience entails taking your platform, your technology, whatever it is, and thinking about it, right? I thought my platform was perfect for everybody, of course, right? But it's not. And so Liz and Aditi and the team really focused on funneling that down to the appropriate people, making those calls, those introductions. So identifying those folks is key. Having people that can help you do that is key. I think attending forums like what we're talking about today was critical in our ability to move this forward. And my friend who introduced me to Liz also suggested the same thing. So it's pretty consistent. I would also suggest you need to be patient, you need to be persistent. Even if somebody said no today, follow up and let them know how you're progressing. Establish shelf space with people because you never know when the budget's going to go back their way and from pox to Lassa fever in my prior example. And I think that speaking with other folks outside of the DoD proper who have contacts at the DoD who can support your efforts there is also really key. One of the things that I think we did again on that dual use aspect of what they're interested in is, if your platform allows you to say this, I would talk about its reproducibility, its scalability, how it's not always just about the science. Hey, our team has spent a lot of time on manufacturing to make sure we can scale this into the general population. Those little points go a long way, I think, Aditya. And I look forward to continuing to pursue our other initiatives in cancer and elsewhere with Voltron. So thank you.
Thanks so much, Pat. Yeah, you hit on all the points, exactly as, as a seasoned veteran here. Yeah, you really have to meet the DoD where they are and be, forthright about what your capabilities are, but also have to be meeting a need that they have. It's a very key point there. And, actually having, that dual use component that you alluded to earlier is super helpful, particularly in engagements with other sectors. So thanks so much, Pat. This was super helpful. And I think very valuable for some of the folks listening in. I think we can pull the slides back up if we can.
Yeah, and I can take it from here to talk about some tips for MHSRS and beyond. So, number one, you want to be tracking the funding opportunities and conferences that are happening. So, you've got the GBG reporting service, our monthly call, first half hour free and open to everyone. So, there are resources for you to help manage that. Second, you want to make sure you're crafting messaging that is tailored to your audience and really right to the point. So, for example, with one of our clients we worked with for several years, we helped get them an appropriation. It was a little over $1 million that first year. So the messaging that we put into our white paper for Congress was different than what we did directly for DoD. So we talked about not just the innovation and why it was needed for military warfighters, but then we also talked about the economic impact of how funding this research would lead to more jobs back home in the district. And we invited the member to come out and tour and interact and meet the employees and learn about the impact in the district. Like that was really important for congressional. But over the years, we kept getting more and more funding, and we did it through congressionals, and then we also did it directly through DoD, and we got a DARPA contract. Well, that was very different communication style for that. So it's just really important to take the time to make that focused, tailored, and don't get too into that weeds in that initial communication because you've got a lot of gatekeepers, you've got a lot of busy people. And while they may have PhDs and MDs and all kinds of backgrounds, they are not a specialist in your area. So messaging is super, super important. Next, you want to understand what you are applying for and make sure you're aligned. So we have had examples, for example, with that CDMRP program, where folks were pursuing the wrong kind of grant. They weren't in that early stage, they were more advanced, or vice versa. Is it a grant versus a contract? Just make sure that you know what you are applying for and that you really do fit into that. Next, make sure you develop those relationships with program managers and really build collaborations. And of course, you want funding. Everyone wants funding, but it doesn't always start out that way. Sometimes it starts out with just a simple exchange of information. Maybe you do some research together to get data, and then that turns into funding opportunities. And just by teaming up, you can go after intramural funding opportunities because the DoD is the lead and the partner that you could never pursue on your own. You're on your own, you can only do extramural. So that's one example. We facilitate a lot of these types of transfer of information, data kind of contracts that then lead to the funding grants. So that's a good opportunity to keep in mind. Um, you want to follow the deadlines and the budget guidelines. So remember, October 1 is the start of the new fiscal year. So keep that in mind in addition to always, always meeting those deadlines. There's rarely any exception if you miss that deadline. So key to that is the next bullet, making sure you do all your registrations with SAM, etc., before that submission deadline, long before that deadline, so that if you hit any bumps in the road, that's not going to block you from making your submission. You want to keep pre-applications and quad charts nice and short, simple, and clear. So for DoD, it's usually a two-pronged process where you have like a short 4-page submission that includes a quad chart. And then once you're accepted for that, then you're invited to do a full submission. And generally, they're not going to invite you to do that second step unless they really want to fund you. And the people that are deciding that first prong are the same program managers and folks we're developing relationships with at MHSRS and through our relationships when we go to Fort Detrick, we go down to Fort Sam Houston or San Antonio. We purposely go out to where they are, develop those relationships, really show what our innovation can do, and those are going to be the ones that are making that decision with that first prong. They also are the ones that are guiding through the broad agency announcements. So not just the program grant announcements, but the BAAs where there's huge discretion within the program managers. Okay, so next, you want to check the grant reviewers and past awards. That is all available publicly, and that can be helpful as you're trying to figure out how are we distinctive, unique, novel, really meeting a military need. Consider who controls the funding and the topics. So, in other words, is it DoD? Is it DARPA? Is it ARPA-H? Like where is that source? And then how is this set up to fund so that you are really aligning? You do not want to apply for something that just isn't a fit. If you're 80% there, you can tweak and make that fit. But if you're not really a fit, no one wants to waste their time. Explore consortiums. So like there's MTech, there's many other consortiums out there in this military innovation space that can be a great source of funding. Where you can build support. And a lot of the folks are, especially Army, are making decisions for MTech as well as for the program announcements and the BAAs. I've talked about the BAA. I mean, we have a great story of how we just developed a relationship. And then by going to MHSRS, we got the final yes, we want to fund you. That then we made the submission for the broad agency announcement, got accepted for that, and then got funded. So many of these different points come together to really be successful. Being persistent, building relationships, aligning. We keep saying aligning over and over again. That's super important. I have yet another example where I had brought the client to Fort Detrick to meet with a program manager who was sort of like polite, but not that interested. I talked with him privately to find out what was going on. And he said, basically, I already work with another company. We've got an innovation in this space. I just don't see the need. So I brought that back to the client. We regrouped. We did better analysis on this other company on what our capabilities were. And I went back to the program manager and I said, we're going to MHSRS. We want to see you. We've got some new information. Can you please meet with us? He did meet with us. He raised an eyebrow and said, wow, I guess I do see how you fit together. Come back, Liz, follow up with me when we're back after. So followed up with him again. He basically rewrote the grant narrative to fit for both. So that's an example of where persistence, really listening as well as presenting, tailoring, meeting up at MHSRS, all those things came together for that award. Okay, so those are the tips. And next slide, back to you, Aditya.
Yes, as has been alluded to before. So if you did watch this presentation, watched our conversation with Pat, and you're interested, in engaging with DoD, interested in, having G2G potentially represent you at MHSRS, our door is open. We're more than happy to work with folks who are interested but not sure where to start. We're happy to do a full sort of representation at this conference in about a month's time, including identifying and meeting with DoD contacts, attending key breakout sessions that align with your interests and technologies, guiding that critical post-conference follow-up that I don't think we've had enough time to talk about, but is super, super important. And providing you with broader strategy in terms of pursuing government funding and collaborations, from multiple angles. So particularly for MHSRS, if you are interested in that angle, I would request that folks reach out to us as soon as possible. Given that this conference is in early August, we'd love it if you could reach out to us by close of business on Friday, July 18. Yeah, and feel free, of course, to reach out to me and to Liz. We'll put our emails in the chat with any questions, any potential routes you want to work together on. We're very eager to, work with you all, finding where you might align with helping the needs of our war fighters and veterans. And I think that's it, isn't it? Can we go to the next slide?
Couple more.
Yep.
Here we go. That's our contact info. Happy to answer questions. It looks like there was real quick. We can do a couple questions. So there was a question on dual use, Aditya, if you wanted to explain that.
Yeah, so just at a very high level, it's technologies, goods, products that have both, military and civilian applications. It can be something like Pat's platform, where it's, a vaccine platform for, both use in specific military settings, but also has broader applications in the civilian space. But also things like, material that might be like used for a specific medical purpose in the civilian space, but has a completely different application in the military space. So that's also yeah, that's the definition at a high level.
Yeah, it's super important to the military to have that dual use. They want these, if they're going to invest in innovation, they want that innovation to last and exist beyond the military. Because, the military, we're in wars and then we're out of wars. So what's interesting is we've seen over the years, certain products have done really well because we're in the middle of a conflict. And so they need to have combat casualty care tools that they wouldn't necessarily need at that level when we're not in any kind of conflict. So it can ebb and flow, but the key is being in that system and being known. I think getting on their radar is super, super important for if you're trying to access funding and collaborations. I think there were a couple other questions, but we answered those. So if I don't see any more posted, then I think we will wrap things up. It looks like, yeah, because we answered the other ones when we were talking. So thank you all for dialing in. Our emails are there. We're happy to answer other questions. I know today was really just the tip of the iceberg in explaining how to access funding and build these relationships and how MHSRS works. But hopefully it was helpful. And I also want to give a special thank you to Pat Gallagher, who shared a lot of wonderful insights. And I think it's super helpful because he is wearing your shoes, I think, for most of you. So he's a CEO. He knows what, their priorities for running a business and how to navigate DoD as a CEO. So hopefully that was helpful as well. And with that, I think we are done. Thank you so much again for dialing in.